I was just going through my emails and I ran across an article that I really felt as if should be brought to your attention because it definitely will affect you and you won't even know that it's going on. You'll be angry with your doctor. My doctor denied my claim. But was it your doctor or was it a robot? I knew that medicine was going to hopefully take advantage of some of the perks of having artificial intelligence. And I was looking forward to us doing some groundbreaking things as far as rendering more positive healthcare towards our patients. But I guess some of the insurance companies, I don't know, had a little something else in mind. Check out this article. How Cigna saves millions by having its doctors reject claims without reading them. This article was published March 25th, 2023. So basically, there was a doctor and he really wasn't feeling himself. So he, felt like he was feeling a little weak. He felt as if his bones were just kind of not really as strong as they should be. So he went into his doctor and he was tested and realized to be deficient in vitamin D. And I know me, myself, I definitely suffer from vitamin D deficiency. So I could definitely feel them on this. And there will be all kinds of subtle symptoms that you will experience. And it's only if you have an astute physician who actually does a test and they discover that you do have this lab deficiency. So once he realized that, his blood was low in vitamin D, I guess there was a bill or an insurance claim that was submitted to his insurance company for him to have repletion or replacement. And it looks like the claim was denied. And the doctor was like, that letter that they sent just seemed a little bit generic. Because this doctor, he worked as an emergency room physician in the United Kingdom. He stated that the letter he received had vague wording, not personable. He really didn't feel as if a human had written this letter. So he checked in and did a little bit more research, and he came to find out that his claim was one of roughly 60,000 claims that have been denied in one single month. And this is through Cigna, which, I'm not saying anything yay or nay. I'm just saying that this is an article that came to my attention as far as a system that they have set up. Let's get to what the system actually does. So the rejection of the doctor's claim was typical for Cigna to reject something like that. And it is one of the country's largest insurers. The company is built on a system that allows doctors to instantly reject claims and just, push a button. Now, let me give you guys a little background as to how this is actually supposed to take place. Whenever you submit a claim to your insurance company, if there's something about that claim that the insurance company feels like, could we do it another way, or is there a lesser expensive way we could go about addressing this pathology? There is a medical director. Most of the doctors actually work from home. This is actually, a pretty good career for a lot of doctors that are trying to transition from clinical medicine. And they have to review the chart, and they go through the chart in detail. And sometimes they'll even call the doctor who prescribed the procedure in question, and they will make a decision if it should be approved or denied. It appears that Cigna has some kind of a implementation in place where it just goes straight to artificial intelligence, and the whole claim is never even seen by a medical director. According to Cigna, they stated that we can just click and submit, and bam, it's denied, just like in less than 10 seconds. And the company considers this to be efficient and considers this to save time and save money. Come to find out, this review system has been in place for years. Per Cigna, this allows us to automatically approve claims when they are submitted with correct diagnosis and code. So I guess if there's like any one little thing that is considered incorrect, whoop, it's automatically denied. You're talking about a system built to deny claims. As a functional medicine doctor and as a virtual doctor, and currently as a doctor who more so has a membership platform as opposed to insurance. This is one of the main reasons why I really do feel that people should reassess just only having a insurance-based doctor, because there are many ways that we can give you all kinds of supplementation that we all are deficient, even in just helping you with dietary measures, or just help you actually with some exercise measures or sleep measures that can help to replenish some of the deficiencies that we all have. We keep a close eye on deficiencies like this. So there's a good possibility that without even getting to the point of having symptomatology, we would have stumbled, we being functional medicine doctors, would have stumbled on this deficiency. And the good thing, we wouldn't have had to worry about being denied by an insurance company, because you wouldn't have to go through an insurance company. So I do think that insurance is definitely required. Like if you're in a catastrophic type situation, the average functional medicine doctor doesn't have a CT scan in their house or in their car or under their desk. But I really think that we have to be careful, and we have to be a little bit concerned now that artificial intelligence is ramping up, and some of the things that healthcare will use AI for will be to our benefit, and some of the things may be to their financial benefit. And a lot of private equity firms are more so involved with some of the larger healthcare organizations. So just think about it. Really, that means almost your health insurance is on the New York Stock Exchange. So just keep that in mind. And if you do get a letter that sounds a little generic, or maybe you get the letter too soon, like you just left the doctor and now you're getting the letter, maybe it wasn't your doctor who denied you. Maybe it was artificial intelligence. I would recommend that you follow up with your doctor, question the letter, maybe dispute the denial, and consider getting your functional medicine doctor, because we keep an eye on things like this and a whole lot more. Thank you so much for enjoying this content. Don't forget to subscribe, like, share, and I just want you to just be the strongest and the best you possibly could be. TessMD signing off. See you later.